Prostate cancer is a silent danger that many men don't see coming. It often shows up with small signs that are easy to overlook or ignore. Every year, men suffer because they miss these early signs. What begins as a small symptom can quickly grow into a much bigger problem if ignored. But what are these early symptoms? Join us as we reveal early symptoms of prostate you should never ignore. Changes in urine stream. One of the first signs many men notice when their prostate begins to enlarge or experience an imbalance is a change in their urine flow. You might find it harder to start urinating or notice that the stream is weaker than usual. Sometimes the flow can stop and start unexpectedly, interrupting the process of emptying your bladder. These changes can make you feel like you can't fully empty your bladder, leading to discomfort or even anxiety. While these symptoms are often linked to a common condition known as benign prostatic hyperplasia, they can also be early indicators of prostate cancer. In the early stages of prostate cancer, the tumor may press on the urethra, affecting the flow of urine. It's important to recognize that while these urinary changes are not always a sign of cancer, they should not be ignored. If you experience any of these symptoms, it is crucial to seek medical advice as soon as possible. Early detection is key to managing prostate cancer effectively. The earlier the cause is identified, the better the chances for successful treatment and recovery. If you notice any changes in your urinary patterns, don't hesitate to reach out to your healthcare provider. Increase nighttime urination frequency. Waking up multiple times during the night to urinate, a condition known as nocturia, is a common symptom that many men tend to ignore. Nocturia can have many causes, including urinary tract infections, poorly controlled diabetes, and changes in the prostate. When the prostate enlarges, it puts pressure on the bladder, which triggers the frequent need to urinate. This constant urge interrupts sleep, often leaving men feeling tired, frustrated, and irritable the next day. While some degree of nighttime urination can be common with age, it should not be dismissed, especially if it becomes more frequent or is accompanied by other symptoms. If you experience pain, burning, or discomfort while urinating, or notice a change in your urine flow, it could be a sign of a more serious issue, such as prostate cancer. Early detection is crucial for effective treatment, and the symptoms shouldn't be ignored. If you find that you are waking up more often to use the bathroom at night, it's important to discuss it with your healthcare provider. They can help identify the cause and determine whether further testing is needed. Don't wait until the problem gets worse. Seek advice early to ensure the best care and peace of mind. Presence of blood in urine or semen. The presence of blood in the urine, known as hematuria, or in the semen called hemospermia, is a serious symptom that should never be overlooked. While these signs can have many causes, such as urinary tract infections or kidney stones, when linked to the prostate, they may signal the presence of tumor lesions. Prostate cancer can cause blood in the urine or semen, although this symptom is more commonly associated with more advanced stages of the disease. If you notice blood in your urine or semen, it's important not to panic, but to seek medical attention right away. Even if the cause is not cancer, there could be other underlying conditions that need treatment. Early detection and diagnosis are key for effective management, as prostate cancer caught in its early stages is more treatable. To identify the source of the bleeding, doctors may use imaging tests, laboratory analysis, and sometimes a biopsy to confirm whether prostate cancer or another condition is to blame. Even if the bleeding is not caused by cancer, it's crucial that any appearance of blood in bodily fluids is evaluated and investigated thoroughly. Remember, while blood in the urine or semen may not always be a sign of cancer, it should never be ignored, and prompt medical consultation is essential for peace of mind and the best possible care. Pelvic pain or discomfort. Pelvic pain is often mistaken for inflammation or muscle strain, but it's important to consider the possibility of more serious underlying causes, such as prostate cancer. The pelvic region contains several vital structures, including the prostate, and pain in this area may indicate the presence of a tumor. Men experiencing a persistent feeling of heaviness, discomfort, or sharp pain in the lower abdomen, lower back, or genital area should pay close attention as these symptoms could signal prostate issues. In cases of prostate cancer, this pain can radiate to the lower back, hips, or thighs, interfering with daily activities like walking, bending, or sitting for long periods. As the disease progresses, the discomfort may become constant and more severe. Unfortunately, many individuals mistake this symptom for common muscular pain, which delays seeking medical help and potentially a critical diagnosis. If you notice persistent pelvic pain or discomfort, consult a healthcare provider promptly. A comprehensive evaluation, including imaging, blood tests like the PSA test, and sometimes a biopsy, may be necessary to determine the cause. Early detection is vital as timely treatment can improve outcomes and provide relief from the discomfort. Regular screenings are particularly important for men over 50 or those with a family history of prostate cancer. Changes in ejaculation. Prostate cancer can significantly affect the processes involved in producing and releasing seminal fluid. One of the early signs may include noticeable changes during ejaculation. Some men experience a reduction in semen volume, changes in the fluid's texture or color, or even pain during ejaculation. While some symptoms are often mistaken for minor infections or age-related changes, persistent or worsening issues should never be ignored. In some cases, the presence of a tumor can compress or obstruct the ducts responsible for transporting semen, disrupting their function. This may lead to discomfort, a noticeable decrease in fluid quantity, or a thicker, discolored appearance. These symptoms might appear before other, more obvious urinary issues, making them an important early indicator of prostate health problems. If these changes persist for several weeks, seeking medical advice is essential. A healthcare professional may recommend tests such as a prostate exam, prostate-specific antigen blood test, or imaging studies to identify the underlying cause. Early detection and timely intervention play a critical role in improving treatment outcomes. Men over 50 or those with a family history of prostate cancer are at higher risk and should prioritize regular screenings to monitor prostate health, even in the absence of symptoms. Difficulty maintaining an erection. Erectile function depends on the proper coordination of blood vessels, nerves, hormones, and the prostate gland. While erectile dysfunction is often linked to conditions such as diabetes, high blood pressure, or side effects of medications, issues with the prostate, including prostate cancer, can also contribute. Tumor growth in the prostate can disrupt nearby nerves and blood flow to the corpora cavernosa of the penis, leading to difficulties in achieving or maintaining an erection. This interference may cause erectile dysfunction to appear suddenly or worsen progressively. In some cases, the problem may be accompanied by other subtle signs, such as pelvic discomfort or changes in urinary habits, further hinting at a prostate-related condition. Though erectile dysfunction is common with aging, sudden or unexplained occurrences should always prompt further evaluation. A visit to a urologist can help determine whether the cause is related to prostate cancer or another underlying issue. Tests like a prostate-specific antigen blood test, imaging studies, or a prostate exam may be recommended. Seeking medical help early not only allows for better management of complications, but can also lead to improved overall health outcomes, especially if prostate cancer is detected in its early stages. Regular screenings are crucial for men over 50 or those at higher risk. Unexplained weight loss. Unintentional weight loss is often a warning sign of many serious illnesses, including cancer. In the case of prostate cancer, especially in its advanced stages, metabolic changes caused by the disease can lead to significant weight loss. These changes are often linked to the body's response to tumor growth, which may involve inflammation, hormonal shifts, and a reduction in appetite. Men with prostate cancer may notice a gradual loss of both muscle mass and fat, even if their diet or physical activity has not changed. This unexplained weight loss is frequently accompanied by other symptoms, such as constant fatigue, weakness, and a pale appearance. If your clothes suddenly feel looser and your appetite diminishes without any obvious cause, it's important to take these changes seriously. While weight loss can also result from other health conditions such as hyperthyroidism, diabetes, or gastrointestinal disorders, it's crucial to undergo a thorough medical evaluation to determine the exact cause. Tests like blood work, imaging, and biopsies may be necessary to identify whether prostate cancer or another issue is responsible. Early detection is key to addressing the underlying problems and improving overall health and quality of life. Feeling of bladder pressure. One of the common symptoms of prostate issues, including prostate cancer, is the persistent sensation of a full bladder even after urinating. This feeling occurs because an enlarged or inflamed prostate can partially block the flow of urine, preventing the bladder from emptying completely. The remaining urine creates a sense of pressure in the pelvic region, leading to discomfort and frustration. Men often find themselves straining their abdominal muscles to urinate, which may provide temporary relief but adds to the discomfort and can cause additional strain on the bladder. This issue should not be ignored, as it may lead to complications like recurring urinary tract infections. Residual urine in the bladder creates an ideal environment for bacterial growth, increasing the risk of infection. The sensation of bladder pressure can also disrupt daily routines and sleep patterns, especially if combined with nocturia, frequent nighttime urination. Over time, the condition may worsen, impacting the individual's overall quality of life. If these symptoms persist, consulting a specialist is essential. A thorough medical evaluation, including imaging tests, urine analysis, and a PSA, prostate-specific antigen blood test, can help determine whether prostate cancer or another condition is the cause of the symptom. Early diagnosis and treatment are key to better outcomes. Fatigue and persistent tiredness. Persistent fatigue, even during routine activities, can be an early indicator of underlying health issues, including prostate cancer. This relentless tiredness often arises when the body redirects energy to combat a growing tumor. Cancer can disrupt normal metabolic processes, affecting nutrient absorption, oxygen delivery to tissues, and overall energy production. These changes leave men feeling constantly drained, even without engaging in physically or mentally taxing activities. Prostate cancer-related fatigue is often accompanied by other subtle signs, such as difficulty concentrating, irritability, or sleep disturbances. Men who experience a noticeable and unexplained decline in energy levels, despite maintaining regular habits and avoiding stress, should not ignore this symptom. It can significantly impact productivity, emotional well-being, and overall quality of life. Although fatigue is a non-specific symptom and can result from various conditions like anemia, thyroid problems, or chronic stress, it is essential to consider prostate health as a potential factor, especially if other symptoms such as urinary or pelvic discomfort are present. A medical evaluation, including blood tests, imaging, and prostate screenings, can help identify the root cause. Early diagnosis is vital for addressing fatigue effectively and improving overall health outcomes. The role of routine exams. Routine exams are very important for finding prostate cancer early. Two main tests are often used: the prostate-specific antigen test and the digital rectal exam. The PSA test is a simple blood test that checks the level of a protein made by the prostate. High prostate-specific antigen levels don't always mean cancer, but very high levels can be a warning sign. The digital rectal exam is another important test. The doctor uses their finger to check the size, texture, and shape of the prostate. When these two tests are done together, they make it easier to find any problem. Sometimes the doctor may ask for other tests like a transrectal ultrasound or an MRI to get a clearer picture. Men over 50 or 45, if they have risks like a family history, should talk to a doctor about how often to get checked. Early detection saves lives. Which of these symptoms have you noticed before now? Share your thoughts in the comments below. Don't forget to like and subscribe to our channel. Also, click on the next video on your screen. You won't want to miss it.